Other successes, 96% of Medicaid enrollees in Ohio with opioid addiction were able to get treatment. Again, going back to that public health perspective, we know how many folks in Idaho are struggling with opioid addiction and how deleterious that is to our society. You know how often children end up without parents, how often folks end up in jail, robbery, things like that. All those things that are associated with opioid use. And in Ohio, 96% of those folks were able to get treatment. 37% of smokers were able to quit. Again, we know the impact that smoking has on people's health. So, the other trick, 290,000 enrollees were able to get off of Medicaid because they got higher incomes, because they were able to get more stable incomes. There's this misconception, I think, of folks that just think like, oh man, well, folks on Medicaid are just deadbeats. Well, I can tell you from having talked, I feel a little defensive when I hear that because I have talked with so many people around the state that are busting their butts to make ends meet. And nobody's trying to take advantage of like this sweet Uncle Sam funded Z-Pack when they get a sinus infection. You know, people just want access so they can get better. So that sinus infection doesn't turn into pneumonia, doesn't turn into that many more days missed of work, right? So this idea that people are just like gonna sit around and play video games if they have access to healthcare is a little ludicrous to me. And I think at one time Dan and I were talking about this. 60% of folks that are in the Medicaid coverage gap are working 40 hours a week, usually through patching together 2 or 3 part-time jobs. 20% of those are working part-time and probably caring for children or their elderly parents in the additional hours during the week. And then the other 20% are folks with chronic illness or disabilities and things that preclude them from being able to work. So, I'm not gonna, Michigan. I put these up here just because these, you can check the news like weekly and find more and more good information about the positive effects of Medicaid expansion. These were both posted within the past 2 weeks, and so I use these. Enrollment, again, going back to that bigger perspective, enrollment in Medicaid is seen with larger financial health. So people aren't, like, obviously, people aren't claiming bankruptcies. They're able to invest more in their communities. No-brainers. So, that kind of gets us to where we are today. Through the whole petition drive, yeah.
My question refers to these last few slides.
I can go ahead. Yes.
Idaho has something unusual in that we have the CAT fund, indigent care, with a mandate for counties that they must deal with it. Did you mention Montana, Ohio, and Michigan? Do any other states that have expanded Medicaid, do they have a similar system where, in other words, there is an alternative of sorts to Medicaid? In other words, our counties first and then the CAP.
Do you know that specifically?
You have to understand, Medicaid is health insurance.
Yes.
The CAT fund is paying for care after it has been
Oh,
given.
yes, that I understand.
So they're different. And the issue that is significant, Idaho is the only state that has the catastrophic and indigent coverage.
The only ones.
Yep. And so that is why the financial benefit to Idaho is much clearer
Yeah.
than in other states.
Yeah.
We're already paying for it straight out of the taxpayer's dollar. And so that would change. Now, the initiative has nothing in the initiative literature to get rid of
Oh, no,
the
that
CAP
wasn't-
fund.
that wasn't my question.
Correct.
Just wanted
The
to say
the
that other
initiative
states
is
have-
only addressing expanding Medicaid eligibility. Should the initiative pass, I would look to the legislature to respond to what are we going to do with the catastrophic and indigent fund. Just like I told you, when I first went to the legislature, before the Affordable Care Act was in place, we were paying short of $100 million a year for the uninsured in Idaho. About 4 years later, it's down to $10 million. So those numbers shot down because people got insurance. The other, this is going to be arcane, but in the Affordable Care Act, there was a initial clause called the pre-existing condition insurance program, so that if people showed up for care that had a pre-existing condition that hadn't been able to enroll, we could enroll them and not wait for an enrollment period. So in the CAP fund, we enrolled hundreds of people in Idaho in that section of the Affordable Care Act called the PCIP. The PCIP, pre-existing condition insurance program, is gone now because it's 10 years old.
Dan?
So, Emily, should we transition to questions?
Can I just quickly wrap up by just saying, if you are looking to get involved, I have put up several different events that we have going on. So this Saturday, we actually have a canvas leaving here at 10 a.m. And we'd love to have you. There's phone banking. Mary has signups in the back. There's also opportunities to write letters to the editor, op-eds, et cetera, et cetera. So please talk to us if you'd like to get involved in this worthy cause. There's usually donuts at the events. The other thing I want to say is there, October 20th, the Medicaid Mobile will be in the U of I Homecoming Parade, and so that's a pretty fun thing. Yeah. Oh yeah, we're just...
The League of Women Voters is also doing a letter to the editor campaign for the healthcare for Prop 2, so, and I will be doing that for the league as well as the Women's Healthcare. So I'm going to send around, if you're interested in writing a letter to the editor, please do your email. I'm just going to send this around as well.
Thanks.
As a canvas.
The other thing I will add is there's a bunch of palm cards in the back. I would love if you took some of those and handed those out to your friends, neighbors, coworkers, book group folks, just to continue to spread the word. Like I said, we know that when we get out and talk to people, this proposition is overwhelmingly supported. It continues to poll at well over 50%, but that means that we need to continue to turn people out to the polls and make sure that folks are getting there. One question that I do often get, so I hope I'm not stepping on somebody's toes, what happens after it passes? So the legislature will need to, after it passes, it becomes the law, right? The legislature will need to find a way to fund that 10%. Again, it will be absorbed by the reductions in the catastrophic and indigent care fund, but that will be something that needs to be voted on. I know that there have been some candidates who have come out and said that they will do everything they possibly can to overturn the will of the voters, and to me that seems like political suicide. So I would just say that we need to get out and make sure that we win big so that those legislators are held responsible to upholding the will of the people. And I think now it's time for questions. Yes?
There's been another hero in this whole episode, and that is our hospitals, the charity that they grant. I know Brooklyn here in Moscow figures around $3 million a year. You take the total amount of charity that the hospitals have contributed in Idaho, that has made a big difference. And with the passage of Proposition 2, that's going to enable the hospital like St. Mary's to reestablish really critical units and departments.
You're right, Tom. In the United States, in the last 3 years, 150 small-town rural hospitals have closed. 80% of those have been in states that did not expand Medicaid. So this will be a significant funding benefit to rural small hospitals. Tony.
Yeah, I'm trying to get educated on this. I just got educated the last couple of weeks. First question, is Medicaid connected at all to Obamacare?
Well, through this, it is. As I explained, Obamacare is what I was referring to as the Affordable Care Act. The Affordable Care Act that passed in Congress 10 years ago. The compromise in the Affordable Care Act was that private insurance companies did not want poor people dumped on them. And so the federal government, in writing the Affordable Care Act, said, okay, People below 100% of the federal poverty level will keep off those exchanges by enrolling them in Medicaid. That's the law. But then the Supreme Court said you cannot require states to expand Medicaid eligibility. Some states, by the way, before the Affordable Care Act passed, had Medicaid eligibility up to above 100% of the federal poverty level. Every state chooses where to put their enrollment limits. Idaho, if you are a single adult, if you're an adult with no children in the state of Idaho, do you know how much, if you earn $1, you are not eligible for Medicaid?
I got like 4 questions. Can I keep rolling?
Well, let's see if anybody else has one and then we can come back to you. If somebody else wants to.
We're also available after, Tony, to talk. Yeah, Jim?
What kinds of arguments against the expansion of the What kinds of arguments against the expansion of the
So the question was, what are the arguments against expanding Medicaid?
Yeah. Not truthful ones at this point. Well, we have heard one thing, which is this is the expansion of Obamacare. The Medicaid expansion was the most popular provision of the Affordable Care Act. So that doesn't hold a lot of water. It's also been the most successful. I showed all of those different indicators of economic and, health outcomes that were positive. The other thing we have heard is that this will take money from public school funding and infrastructure funding, which is not true. I'll just say that unequivocally, that is not true. The irony there is that finally the Idaho Freedom Foundation is advocating for public school funding, so I guess that's a win. The third thing that we've heard, there was a Right to Life group that said that this would push money to Planned Parenthood. There are 3 Planned Parenthood clinics, so no federal funds can go to abortion, period, stop. This will go to contraceptive funding, not just at the 3 Planned Parenthoods around the state, but at any health clinic. And I think those of us with common sense can agree the way to reduce unwanted pregnancies is to allow people to have access to contraception. So again, I don't think any of the arguments hold weight particularly, but that is what we've heard so far. I've also just heard that I'm a socialist, which is not also true.
Well, the other question, and I believe this is a fair concern, and I think it's something everybody ought to think about. It is going to add to the federal deficit. And if you look at our federal deficit, is it adding to it directly? The Affordable Care Act, the way it was written when it was passed, it actually was a balanced budget law. A bunch of things have not been done since it passed to keep that fiscal honesty in place. Before the Affordable Care Act passed, hospitals got a certain amount of payments for the uninsured. Those have now gone away. So hospitals are seeing their budgets being cut significantly, and this would benefit them. But the fundamental issue is, how are we going to pay for healthcare in this country? How are we going to do it? And in my opinion, that is I believe it's a generational question that we as a country are avoiding. And to me, everybody should get up every day and look in the mirror and say, what debt am I leaving my grandchildren? And we are leaving them a debt. And this healthcare issue, in my opinion, is a big part of it. And if you don't want to face it, and you want to pass it on to your grandkids, shame on you.